for our Insight VR IOL stimulator.
Cataract. In spite of all the advancements in ophthalmology, cataract remains the leading cause of blindness in the world. From its first ever surgery done in the 1700s, it's increased in popularity and now it is the most common surgery being performed in the world. The market has a dizzying array of options available for the intraocular lenses. In most high volume hospitals, the doctor advises the patient cataract surgery, but the counseling part is usually taken care by the designated counseling professionals. Will attempt to explain the features of different types of IOLs available using the aids of pamphlets and charts. This information overload can be overwhelming for the patients, frequently leaving them confused and indecisive. Presenting our solution Insight. Our engineers work day and night on a software called Unity to make two immersive virtual reality scenarios. Three reference points are kept to emulate near, intermediate, and distance vision, and we modify them to simulate vision with different IOLs. For example, here we show vision with monofocal, bifocal, multifocal, and EDOF lenses. Similarly, our outdoor scene recreates vision with cataract, monofocal, bifocal, multifocal in day as well as night and EDOF lenses. Not only the focal points but also the contrast and saturations have been altered to simulate accurate view of the surroundings. For example, in multifocal light you can see the halos and glare that is expected. This might appear very futuristic, but all you need is a VR headset which you can get for as low as 400 rupees, or one can also download the free for all Google Cardboard PDF to build cost effective homemade VR goggles. To test out our product, we conducted a small survey wherein we asked a variety of people to try the VR experience and give their honest reviews. We showed it to doctors, MLOPs, PGs, and also one patient and his attendants. And to our delight, here is the feedback we received from them. All the participants felt that Insight would be beneficial for the patients and ease their decision making process. We asked experts if Insight somewhat correctly emulates post-op vision, and 83% of them concurred. More than 80% people agreed that Insight would make the counseling process easier and smoother. We can keep one in all the counseling cubicles, as all you need is a VR goggles and any regular Android phone to run the free app. About 95% people felt that patients are more prone to choose premium IOLs once they better understand the details using Insight. Most of our participants also felt that this would help address post-op dissatisfaction by providing realistic expectations.
Before sir, we are showing how will be the feeling and everything. So the patient knows it.
After receiving such a positive response, we conducted a pilot in how to use and implement Insight. The Insight VR experience was shown to all the patients who were advised cataract surgery, and it was very well received. The advantages of Insight is that it is a cost-effective solution which is freely available to all. It is easy and it provides a realistic experience to doctors, sisters, patients and their attenders. There are multiple advances possible, for example to mimic vision with other diseases like glaucoma, adding more scenarios and the ability to move inside the scenarios.
Thank you, Dr. Anahita. Thank you. Very useful gadget. Question?
You can show, please.
This is the app. So I have different apps for multiple scenarios, and if we put it in the VR headset, it transforms us into a scene which we feel we are actually in there. So it's an immersive thing, and this is like a generic for all the IOLs. It's not a particular like Synergy or AuroView, but generic like monofocal. What we tell the patients, you won't be able to see near, intermediate, but distance will be clear. And multifocal, you will be able to see all ranges with clarity, but there will be a slight lack in contrast, and there will be halos at night. So we have tried all the positive as well as negative aspects of all the IOLs, so that the patients can have a better decision making experience.
Yeah. I think it is of great importance, and I think all of you know, and ma'am especially must be knowing, a famous celebrity. He went for a VVT lens, and he had lot of problems with that IOL and all. So I think if you have this inside VR, I think patient is much more convinced.
Yeah, it is.
My question is only how to, adults can understand, but what about pediatric age group, or means slightly less than 14, who are not that mature enough?
So like very
how,
less
how
than
to
10
tackle
peop-
these people? I
So
think,
less
yeah.
than parents have to decide. And sir,
But parents cannot see through it, no? How can?
sir,
Yeah, even the
Can
kids are
use it
using,
and
sir,
say.
the kids also using the VR headsets. In fact, a lot of immersive gaming nowadays is these headsets.
so even you can.
And
No, the patient's father.
only the father would be able to see, and
He will
yeah.
fit it on his head and see. Good. Ah.
I think there were other, like I think Alcon also had something like
Dr.
this
Vignesh?
in its arsenal. Now they've made it freely available through open source. So I think it's a very nice advancement as well as an innovation.